Motivational interviewing is recommended as an evidence-based approach to behavior change. Key components of motivational interviewing include: it is a guiding style of communication that balances good listening and giving information and advice. Motivational interviewing is designed to help individuals draw out their own meaning, importance, and capacity for change by assisting them to feel empowered. And most importantly, it's done in such a way that honors the patient's autonomy, which is based on a respectful and curious way of communicating with people. So the natural process of change is honored. The goal is to utilize a style of communication that is collaborative and goal-oriented. Particular attention to the language of change is a key element of this communication style. Motivational interviewing is designed to strengthen personal motivation for a specific goal by exploring and eliciting a person's own reasons for change in an environment of acceptance and compassion. While motivational interviewing is useful in a variety of conversations, the skills and principles are particularly useful to help people examine their situation and realize options when the following environment is present: ambivalence is high, confidence is low, desire is low, and importance is low. The process of change can cause individuals to feel stuck in mixed emotions, doubt their abilities to succeed, uncertain that they want to make a change, and not hold a clear picture of the benefits and disadvantages of change. Some core components of motivational interviewing are: it's practiced as a way of existing with people, which include compassion. The practitioner actively promotes clients' welfare in a selfless manner. Partnership. People are experts of their own life. The practice of motivational interviewing is a way to help people through the change process. Acceptance. The motivational interviewing practitioner seeks to understand the patient's perspective and experiences by expressing empathy, highlighting the patient's strengths, and respecting the person's right to make informed choices about change. Evocation. Within themselves, people possess the resources and skills needed for change. Motivational interviewing techniques draw out a person's values and inherent wisdom to explore reasons for change that support success. Core skills of motivational interviewing are: acknowledge that both the patient and provider have expertise by sharing of information. This process is considered a two-way street, and the practitioner needs to be responsive to what the patient is saying. Open-ended questions. Information can be exchanged with a dialogue of open questions, such as the elicit, provide, elicit approach. Open-ended questions draw out and help explore the person's experiences, perspectives, and ideas. Guiding questions evoke the patient to reflect on how change may be meaningful or even possible. This process of interaction with the patient explores what the person already knows, and by seeking permission, the practitioner can offer what they know, then explore the patient's response. Affirmation. Affirm the patient's strengths and past successes to help build the patient's confidence in their ability to change. Highlight and congratulate past successes. Reflections. A foundational skill of motivational interviewing is how we express empathy. Reflections are based on careful listening and trying to understand what the patient is saying. By repeating or rephrasing and offering a deeper guess about what the patient is trying to communicate, reflection demonstrates empathy and validates how the person feels. This is a very important step in developing a mutual relationship. Summarizing. Validates and shows understanding and reinforces key points made by the patient. The process. These guidelines describe the flow of the conversation: engage, focus, evoke, and plan. Engaging is the foundation of motivational interviewing. Establish a productive working relationship through careful listening, accurately reflecting the person's experiences and perspective while affirming their strengths. Focus is a process of negotiation that creates an agenda that draws on the client and patient expertise to agree on a shared purpose and gives the practitioner permission to guide the conversation about change. Evoking is the process of gently exploring and helping the patient build their own change process through listing their ideas and motivations. Ambivalence is expected and normalized. Explore without judgment to reach a workable resolution. Careful attention should be given to the patient's change talk. Planning explores the how of the change process. The practitioner supports the patient to develop a plan based on their own insights and expertise. The timing of this step is very important in the readiness of change for the patient. In summary, motivational interviewing is considered a method of communication rather than an intervention, used on its own or combined with other modalities. Motivational interviewing is compatible with the values of many settings and evidence-based approaches, and the full framework of motivational interviewing is a complex skill set that requires time, patience, and practice. The core principles have a common sense appeal and can readily be applied in a clinical practice. Consider motivational interviewing as a spirit of being with people.